Hi, I'm Hillary Acer, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. Today, we continue our NextGen Journeys series featuring conversations with learners and early career clinicians around the globe to get their fresh perspectives on education, medicine, and the future of healthcare. We're going to do that today with Dr. Estello Hill, who is wrapping up his internal medicine residency at the University of British Columbia, where he earned his medical degree as well. He's now pursuing a fellowship in gastroenterology at UBC and has special interests in the gut microbiome, longevity medicine, and integrating artificial intelligence with the future of medicine. For the past 3 years, Estello has been a writer for Osmosis, and previous to that, he participated in our medical education fellowship program. Unlike any of our previous guests, Estello is also an elite plant-based athlete, competing in Ironman competitions and multiple ultramarathons while completing his residency. And if that were not enough, he's also the co-founder and president of Social Sport, which helps newly immigrated children get involved with sports and recreation programs. Estello, it is a huge pleasure to have you today. Welcome.
Thank you so much for having me, Hillary. I'm happy to be on the show today. And in terms of finishing my internal residency program, I actually just found out this morning that I passed all of my board exams. So as of this moment, it's officially official.
Wow, that's huge. Congratulations. That must feel like a big weight off your shoulders. I know how much work and time and energy and effort goes into that. So congrats. It's great news to receive.
I'm happy to be done.
Yeah, I'm sure. Gosh, well, let's rewind the clock a little bit and start at the beginning of your journey and what got you interested in pursuing medical education. And, I know you started studying English literature and world religions in college. So how did you find your way into medicine?
From an early age, I was probably exposed to the medical field right away because my mom's a nurse. And so, the medical kind of professions and that as a potential career had always kind of popped up early on in my mind. And I'd enjoyed it and thought about it throughout high school and elementary school. But when I was going to university, I went to McGill to play football and play on the football team. And all I was really thinking about was, what's my athletic career going to look like? And then I played through my first season and kind of got the sense that football wasn't going to be the end all be all. And I remember asking myself if I could pick something that wasn't being a professional athlete, what would kind of give me the most purpose and be the most fulfilling journey and path. And the hard but true answer for me was picking medicine. And so after my first year, I remember I went to the advisors for the Faculty of Science, and I was in the Faculty of Arts, and I asked them, oh, could I transfer into the sciences? And they said, oh, well, you need to take all these courses, you need to get a almost perfect GPA to transfer in, all this kind of stuff. And everybody kind of thought that it'd be a unlikely thing to do, but I did it. I got some tutors, and I worked pretty hard. I ended up quitting the football team, but playing on the rugby team for the remainder of my university career. And that's kind of how I got into that.
Wow, what an interesting journey. And I see a lot of parallels actually between being a professional competitive athlete and in your undergrad career, as well as studying medicine. There's just a lot of discipline required to do both of those things. They're very difficult in my mind. So it's interesting that you made your way from that competitive athletic environment into kind of a competitive academic environment. And it sounds like you worked really hard, along the journey. So you're currently finishing up your gastroenterology or your internal medicine residency rather, and you're going now to specialize in gastroenterology. So how did you end up choosing that as a specialty?
I think gastroenterology is a specialty that I got exposed to also kind of young. It's when I was 18 in my senior year of high school. My aunt, who I was quite close with, passed away from colon cancer. It was a pretty tough time for the family. And I remember kind of seeing her get sick. And colon cancer is one of the cancers that, if caught early, can be prevented. But this was unfortunately caught a little bit late, and she was quite young. And so that was the first kind of exposure to it that I got. And then when I decided that I wanted to pursue medicine, I ended up getting a volunteer position as a research assistant in a gastroenterology research clinic and lab. And so a lot of the early research that I got to do was also around gastroenterology. And so I kind of spent my pre-med years doing GI research and having kind of a relevant family history with it. And then my mom, who's a nurse, actually ended up switching positions. She is an ICU nurse initially, and then switched over to working as a endoscopy nurse in the GI clinic. So I got a lot of exposure all across the board. When I started medical school, I actually said, I'm super keen for everything except gastroenterology. I was kind of wanting to see what everything else was like and to really broaden my horizons. I thought about surgery, I thought about psychiatry, family medicine, radiology. It seemed like everything I came across, I could see a foreseeable future where I'd enjoy being that kind of doctor. And then I came to my internal medicine rotation and I ended up liking it a lot more than I thought I would. And I'd always been intimidated by how academic, how cerebral, how complicated a lot of internal medicine was. But actually doing it, I found a lot of autonomy and independence in being able to take care of my patients. And I really enjoyed feeling like a full-blown, Dr. House, figuring out these crazy cases. And then I also really enjoyed procedures, and I thought about surgery, and I thought about potentially picking something that was a lot more procedural. And then you have gastroenterology, which is a internal medicine-based specialty that allows you to use that big brain that you've developed over all of these years, but is also heavily procedure-based. So you get a good mix of both. I had a kind of personal family connection to it. I had the opportunity to do research in that field for several years. And so all of those things put together, I figured I would be silly not to pick gastroenterology as my specialty, and here we are today.
Wow, thanks for walking us through that. And I'm terribly sorry to hear that you lost your aunt to colon cancer early on. That sounds like a really formative and difficult experience to go through, but also something that led you down this very meaningful path that you're on today in trying to help others in perhaps similar situations. And also really neat that your mom has also found her way into this new field as well. So I'd love to know a little bit more about your kind of intentions for this fellowship that you're about to step into at UBC and maybe what your future goals are around gastroenterology.
Yeah, so entering into fellowship is a huge step for me because up until this point, a lot of the work that's been done has all been done to get here. You have, pre-med, med school, internal medicine residency, all those things didn't accurately represent what my daily life is going to look like as a gastroenterologist. And so there was a lot of doing things that you might not necessarily do for the rest of your career, and a lot of kind of going through things in order to just kind of make it through in order to get to this point. And so now that I'm finally at this point, my intentions are to really sit back and enjoy being able to learn the stuff. I guess I've learned most of it already, but to really dive into becoming a specialist within this field. It is a incredibly procedural specialty, so I think that like professional sports, like high-level athletics, you get really good at a certain skill by practicing it. And I think that with a lot of the skills involved with being a gastroenterologist, one thing that I'm looking forward to is just getting a lot of reps and getting a lot of opportunities to build my craft and kind of build the skill set that I'll need to be an independent practitioner. I'm also really looking forward to stepping into the role of the physician in situations where I've seen many, many people. How should I word this? So having gone through and done and been a research assistant in the field and been a med student, been a internal medicine resident, you're always kind of in a supporting role to now finally step into the role of like the gastroenterologist to diagnose people with colon cancer, to help them through that, to be the point of contact for all of these diseases that I'd studied and taken care of over the years is a very inspiring and happy moment for me. And so that's kind of just like the practical, emotional side of things. And in terms of the academic side, I've come to really find an interest in the gut microbiome and kind of the future of some medical techniques and medical advancements that we're making there. And so I hope to continue some of the research that I've started in that area throughout fellowship and into whatever practice that I build on the other side.
I'm glad you mentioned the research component again, because I definitely want to learn more about the research that you've done in microbiome and what you're going to continue studying. But I also, really appreciate just the complexity of internal medicine and, all the procedures and just how long it takes to go through this path to end up where you are. And I'm kind of envisioning this triathlon or ultramarathon, as you also have participated in, of medicine, right? And going through, undergrad and then medical school and then residency and now fellowship, where you can kind of finally reach that finish line or kind of finally, you've made it. And it's just a really incredible accomplishment. So congrats again. And I'm sure you'll have a huge impact on your patients and really being able to leverage the tools that you've gained, both again, as kind of that family member of someone who's gone through something very difficult like colon cancer, and also as a researcher who's really dug into the subject matter and become a real expert in that field. So let's go down the path of your research in the microbiome. What can you tell us about what you're finding these days?
Yeah, so the gut microbiome is such an exciting and new and promising field. I came across some of the first studies when I was in medical school, and I remember reading this study where they had two different types of mice. One of the strains they were genetically identical mice, and one of the strains they kind of overfed them and they became obese, and then the other strain were normal sized. And they did a fecal transplant and switched the gut microbiomes of the two mice. And the obese mice became skinny, and the skinny mice became obese. And I just remember looking at these photos and thinking to myself, like, how in the world could you have such a profound effect on the entire body of an organism just by switching the gut microbiome? And so from that day onwards, I had been completely enamored and enthralled by this topic. And I've, read as many books as I can, and I've dug into the research, and I've had the opportunity to be involved in wet labs and uh, microbiome labs where we're actually processing microbiome samples and doing whole genome analyses and looking at the difference there. And so one of the studies that I had an opportunity to get involved in is a long-term study that's ongoing, but it's looking at the effects of certain prebiotic supplementation in toddlers and looking at their cognitive development and seeing that if we can optimize and ensure that humans in the developmental stages of their life are getting the appropriate prebiotics that foster a healthy and diverse gut microbiome, if that has any effect on their rate of cognitive development, emotional development, or intellectual development. And so I'm really interested to see where that's going to go. And of course, that's a study that'll take the course of years to come out because of, you got to measure how. And then another study that actually just got accepted for publication in May was a huge collaborative project that I had the pleasure and opportunity to work with researchers and physicians from all around the world, really. And we did a complete review of fecal transplant and microbiome transplant. And we looked at all of the disease conditions that it's being studied in outside of C. diff infections. And so a little bit of context here. The only like FDA approved indicated conditions to do a microbiome transplant outside of the research setting is for recurrent C. diff infections. And so C. diff is a bacteria. And when you have a course of antibiotics or you've got something that causes bacterial dysbiosis, or that kind of wipes out your native gut flora. C. diff is a bacteria that can proliferate and kind of take over, and it can cause really bad inflammation in the colon, diarrhea, even things like toxic megacolon, which are surgical emergencies. And so when somebody has a recurrent bout of this, you can do a fecal transplant or a microbiome transplant. And by implanting a new microbiome, that kind of helps to eradicate this infection. And so that's a very clear cut. Okay, the pathophysiology of the disease is that it's bacterial dysbiosis of the gut, overpopulation of one bad bacteria, C. diff, and the cure for that is then repopulating the microbiome. That's very kind of straightforward and easy to understand. What our research looked at was all of the other things that it's been studied in: inflammatory bowel disease, checkpoint inhibitor colitis, autoimmune hepatitis, primary biliary cholangitis, and even psychiatric conditions like Alzheimer's and autism, and looking at how fecal transplants and microbiome transplants have affected these diseases. And is there a connection to understanding maybe a new potential treatment, or understanding more about how the disease pathophysiology works? And without giving too much of it away, there's a lot of associations that we see between treating these diseases with microbiome transplants and fecal transplants that seem very promising. But one of the struggles we have is the ability to look at the difference between like correlation or causation, and to see that if we're truly like, none of them have truly come out and been like the microbiome transplant is a one-stop shop that completely cures any of these things. But there are a lot of things that suggest that it helps, and that it may have a role in the future. There's still a lot of research to be done, but it's an exciting space that I think is expanding and is going to open up some new understanding for a lot of disease processes that we don't actively understand now, and also potentially open up new treatment pathways and an ability to potentially treat some previously uncurable diseases.
Wow. Thank you for walking us through all of that too. That is some really fascinating research. I mean, when I first heard you talking about the rat study at the beginning, the fecal transplants, I'm kind of imagining some kind of science fiction Stephen King novel or movie, and this is real life. This is how far medicine has come, and it's amazing just to see how advanced we have gotten, and also some of the more promising treatments that may actually extend beyond some of the initial case studies that we've been looking at. For example, C. diff, as you mentioned. So I'd love to follow this research and maybe even link to some of the studies that you've been a part of, and maybe share that with our listeners who are interested in learning more about this in particular and following this progress, because it is a fairly new space and we're still learning a lot about the microbiome. And I think in some ways you could liken it to, the ocean exploration, that there's still so much more to understand. So would love to link that and share those studies out. And so I'd also love to cover your interest in longevity medicine and what draws you to that space.
When I get interested in something, usually the first thing that I do is I reach for a book. And I listen to a lot of the books that I read when I'm on a run or on a bike ride or doing some sort of physical activity. And when I was in medical school, I came across Michael Greger and his nutritionfacts.org, and he's got he's the chair of the College and Physicians, the College of Lifestyle Medicine of America, and he's written several books. How Not to Die was the first one, How Not to Diet the second one, and I think the newest one is called How Not to Age, something along those lines. And he actually just gave a presentation at UBC a few weeks ago that I got to see, which was super cool. And essentially, he outlines in this book that a lot of the diseases that we deal with in modern medicine are actually really preventable, or are really treatable just by focusing on what we eat, how we live our lives, and the foundations of what it means to be a healthy human being. And going through medical school, seeing the complications of diabetes, seeing heart disease, seeing hypertension, seeing chronic kidney disease, and all these things, and knowing that a lot of this stuff is preventable with a healthy diet and lifestyle. It just made so much sense to me to optimize my life for longevity. And by that, I mean live my life in a way that the foods and the diet that I choose to eat, to the best of my knowledge, is going to help me to live long and healthy and be strong and fit. And at the same time, I wanted to take a new spin to it, that I took a lot of the information from these books and from a lot of the other specialists in the field. Somebody I also look up to a lot is Peter Attia and his podcast, The Drive, which I think is really great for longevity medicine. And I wanted to put my own spin on it and create a lifestyle or a plan that allowed me to optimize for performance at the same time. And so that's how a lot of the Ironman training, the ultramarathon running, the marathon running, the weightlifting, the physical fitness tied into everything for me. And so that's kind of how my interest has started. I hope that as I go through my gastroenterology training, that I'll still have time and space to have a longevity medicine practice within the realm of my internal medicine expertise. And whether that's working with patients to optimize their lifestyle or to decrease their risk factors, the idea of optimizing for health and optimizing for not just the amount of years that we have, but to optimize for the amount of healthy years that we have to live is something that I think is incredibly meaningful.
I've also followed Peter Attia and finished the book Outlive recently, and I find it to be very helpful. And yeah, this idea, as you just mentioned, of health span versus lifespan. How can we really optimize our more quality, fulfilling years where we're healthy and mobile and able to enjoy the things that we love is so much more important than just the number of years that we're counting. So I had actually also downloaded How Not to Die. It's been on my Audible book list for a number of months, if not years now. So I just bumped it up, and thank you for the motivation to dig into some of Dr. Michael Greger's work, because he has been a real leader in this field. So you mentioned a lot too, we've got this interest in microbiome and diet as well as longevity. And a lot of that includes physical activity and, as you mentioned, lifestyle in general. And you've competed in a number of ultramarathons and Ironmans, and it's a very intense kind of competition. So tell us a little bit about how you got into that and how you've managed balancing those very time-consuming pursuits with the demands of medical school and residency.
Yeah, so I'll start this off with letting everybody know that I was never, ever, ever, ever an endurance athlete. I was a football player in high school and university. I was a rugby player. I was a guy who liked to throw some iron around in the gym, lift heavy weights, bench press, get my protein, eat my steak. That was the university version of Estello Hill. And then I came across a lot of this research and stuff like that, and I started to switch over to a plant-based diet in medical school. And I think that is important to mention, because I think that one of the reasons I've been so successful in the ultra and the endurance world is because of the way that I've been treating my body and the foods that I've been eating. In my third year in medical school, I made friends with people who wanted to make a run club. And so UBC is this beautiful campus that's kind of on the coast of Vancouver and in BC. And so it's surrounded by these beautiful forests, oceanside trails, the seawall. There's a lot of space to run. And so in medical school, we started going instead of attending all of the lectures, a lot of the lectures were recorded. And so we would watch the recorded lectures in the morning and then go for an extended run in the forest in the afternoon. And then after lunch, we would have like our anatomy labs or clinical skills and things like that. And so we kind of created this routine where you would do a little bit of studying, go out and run in nature, come back and get some hands-on work. And I just found that that was the most kind of prolific way for me to learn without getting burnt out. It was like the more I was doing academically, the more I needed to do physically in order to kind of disperse the pent-up energy that I had. And so when I was in third year and doing clerkship, I was on the wards and COVID hit. And so right before the end of clerkship, COVID hit. And so I had a forced 3 or 4 month hiatus. And, I think like many people who went through the pandemic, it was a time that brought about, I guess, some big life changes. And so I had been in a relationship. The relationship kind of fell apart during that time as well. And I reached a little bit of a low point. And that's where I found another book that other people might be familiar with, Can't Hurt Me by David Goggins. And I just really connected with that book. And I was like, man, David Goggins is a crazy, inspiring dude. I don't know if I can take it all the way to his level, but who's to say that I can't run an ultramarathon and kind of throw myself at fitness as a way to process a lot of the stuff that I'm going through and find a productive, healthy ground to kind of get myself out of a rut. Because that's truly where I was at. So I started running and running some more and doing a lot of running. I went through my fourth year and I kept up running and got into a little bit of biking. And then I hadn't really ever ran anything like a marathon or anything like that. I was just kind of pushing myself as much as I could. And then half marathon was kind of the most there. And then started residency. And when I started residency, I saw this as a huge academic professional challenge. I knew I was going to have to step up my game. I was going to have to, advance from being a medical student to now being a resident doctor. And something that's always been a theme in my life, dating back to high school, is that whenever there's a huge academic challenge, I perform best when I have a physical challenge to match. So in college, my grades were always better in season when I was actively competing in sport compared to the off season when I had more free time. And so I kind of just thought to myself that I would continue that on throughout my professional career. I didn't have, I was no longer on a sports team, but I had these new activities that I was in. And so when I started residency, is when I also kind of got sponsored by a No Meat Athlete and Complement, which is a plant-based nutrition company. And they were hosting a ultra marathon later that year. And so I kind of took that as a sign to sign up for my first ultra marathon, which was a 50-kilometer trail race with quite a lot of elevation. And then it was off to the races. I kind of started residency and at the same time started training for the ultra marathon. And it took a lot of discipline. It took a lot of sacrifice. It took a lot of shifts in my mindset to the point where it was really understanding that it was about consistency more than it was about perfection. And it was about understanding and learning how medicine ebbs and flows, how some days you're on call 24 hours and you have to account that the next day after that, you have to forgive yourself for not being able to do everything that you normally can do because you literally haven't slept or you have to sleep or you have to do these things. But I was able to really find a balance where the more I could push academically, the more I could push physically. And then, that first ultra marathon came around and I was able to do it. And I did pretty good. And it kind of showed to me that anything you set your mind to with consistency and with dedication and with hard work, with resiliency, you can accomplish. And this is something that parallels so strongly between medicine and athletics for me. But I think it's kind of just one of those big truths about the world is that with, dedicated, consistent hard work, you can truly do whatever you set your mind to. And so I ran the first ultra marathon and then I said, okay, well, I'm going to run a marathon. And then you know, it's like you drink the Kool-Aid and you get a little bit too much of it. So after the first few marathons and ultramarathons, I signed up for an Ironman, and then in my second year of internal medicine residency, trained for the Ironman and raced in several of those races. And it was a incredibly transformative experience in showing me who I'm capable of becoming, and also showing me and giving me the opportunity to inspire others around me. And that's been something that's really stuck with me as well. And I should add that in understanding the ebb and flow of medicine, going into my third year and now, my priorities shifted because I had my board exams, I had to match to my fellowship. And so in the last maybe 6, 7 months, I've had to dial back on the training because I had to pass these exams. And so I put a lot more time and effort into studying. I still had exercise to fall back on, but it changed, and my priority became just making sure to ace these exams. And now that I've aced these exams and that I'm getting ready to start fellowship, it shifts again. And now there's more time for exercise. There's more time for setting physical goals and personal goals. And now I'm able to, pick new races, and I've signed up for 100-kilometer trail race and different things like that. And I've got a training plan again. And so it's really taught me like what I'm capable of, how I can push myself, and when I can push myself, when I should push myself, and when I should dial back and just let it, focus on the medicine side of things. But I think it's given me a intense sense of balance with everything, if that makes sense.
Definitely. And wow, there are so many takeaways in all that you just mentioned. But the first thing I'll mention is that those endorphins must be incredibly strong to get you through a 50-kilometer race or 100-kilometer running race. That's just very extensive and impressive. And it's funny, you also mentioned David Goggins. I remember reading that book a couple of years back and really thinking, dang, I got to up my athletic challenge here. I've got to, push myself a little bit more. And I find it interesting that, within reason, I actually used to do a lot of distance running, and unfortunately got injured. My training plan probably wasn't too smart, but the idea of really challenging yourself physically and going to maybe these end ranges is pretty consistent with what Peter Attia and other longevity docs are saying is really important for us, right? That we need to really challenge our physical capabilities and stay strong. And exercise is one of the best ways to do that. So also wanted to point out the very savvy hack of when you were studying in medical school of listening to those recorded lectures and getting a long run in the forest. That sounds dreamy and much better than sitting in a desk all day or at a lecture hall all day. And certainly that was a similar inspiration for Osmosis with our co-founders, Shiv and Ryan, who were looking for ways to make studying more efficient. And I'm actually not sure if you've connected with Shiv, our CEO, but he and a couple of our teammates within Osmosis and Elsevier, including our chief medical officer, Rishi Desai, and some of our medical illustrators have completed Ironmans. And so it's something that has kind of started to take root in our company as well and be kind of an inspiration internally for our team to stay active. So much more that we could dive into on that topic, but best of luck, Estello, on your future races. And would also be very curious to see kind of what your fuel plan looks like when you're going for these long runs and what your training plan looks like at some point. But for time's sake, maybe we'll table that for conversation number 2 and have you back on for an Ironman or ultramarathon recap episode.
For sure. Sign me up for Team Osmosis. I'm keen to race.
We actually did have onesies made as well, so we can see if there are any extras. Since you are part of the Osmosis team, we haven't covered that too much, but you've definitely been a key member of our team, helping to create content and be part of our fellowship program. So, turning now to just actually maybe before we get to AI, we'll stick on this sports and athletics topic, because you've actually gone beyond just competing yourself and being an athlete yourself to helping children, and in particular immigrated children, get involved in recreational sports. So tell us a little bit about the story behind Social Sport and how that got started and what your mission is.
So Social Sport is a charity which I and a friend founded in 2016. I think. And it came out of the general sensation that we wanted to be able to do something to help so at the time there was tens of thousands of Syrian refugees particularly that were coming into Canada. And I remember thinking to myself that I really wanted to do something to help, but not really knowing how I could help, and thinking that spending my time helping one person would be effective, but not effective at addressing the problem of, like, I was quite overwhelmed with how many people were coming in, and thinking, like, how are you going to help all these people? After reaching out to a lot of the services and the places that were accepting these families in, I realized very quickly that they didn't have a very thought out plan for what they were going to actually do to get these new families integrated into the new communities and the new homes that they've had. And growing up, I can credit organized sport as one of the most influential and impactful entities in my life. I grew up in a single mom household, and as far back as I can remember, we always had people telling us why things weren't going to work out, or, what the statistics were like for single mom households, et cetera, et cetera, et cetera. All these things that my mom decided that we weren't going to listen to. And one outlet that I always had was sport. And so I met all of my friends playing community sport. I had the arena in which to develop my physical abilities, and to ultimately get myself a football scholarship, and to get myself a scholarship out of the public school system and into the private school system for high school. And then going to a better high school allowed me to get my university opportunities. Playing sports in university, I met all of my best friends that I'm still friends with today. It taught me the skills and the mindset in order to succeed and pursue a career like medicine. And then even now, my friends I met through sport, I still meet people through sport. Sport seemed like, to me, the ultimate tool for community building. And so that idea and that sentiment, we turned it into a charity, and essentially just made a funnel so that when immigrant and refugee families came into the country, there would be an opportunity for them to register their kids in the local soccer program, or the local basketball team, football team, hockey team, you name it. And then we connected with the already existing charities that have huge amounts of money that are donated to every year to help these kids play sports. But the big thing was that none of these immigrant families knew how to access these funds. You've got so much funds, but it had this huge wall of, like, they had to fill out an application form in English, and they just came as a refugee. And the most formative years are for those young kids. And so the organization was quite simple. We didn't run sport programs, and we didn't put on big camps or anything like that. But we created a network and a funnel system that took all of the new refugee families and youths and provided them this opportunity. And then next thing you know, all of their kids are playing on sports teams. They're making friends. They're kind of you take a shortcut to getting them involved and committed into the community. And so that was social sport, and was quite successful for quite a few many years. Unfortunately, after COVID, it kind of sputtered around for a little bit, but community sports in general took a huge hit after COVID. And then, so in the last year and a bit, we've actually had to shut the charity down, which has been super unfortunate. But through that process, we had a chance to work with thousands of kids, and we were able to set up these communities and these networks of people that brought me a lot of joy and fulfillment to know that I was able to provide this opportunity. And I think that a lot of the settlement agencies and immigrant agencies got whiff of the kind of program that we are running, and I hope that they will continue to offer sports programs to immigrant families in the future, and to make that a priority. But that was social sport, and it was incredibly rewarding and fulfilling time of my life. And if I could split myself into two, where one, Estello, went on to become a gastroenterologist, and the other one could do, be a charity CEO full time, I would. But unfortunately, there's only so much time in the day.
Well, maybe in the future, there's a world in which you can do both, or the cloning technology gets good enough. Who knows? But yeah, social sports sounds like it really impacted, as you mentioned, thousands of kids. And I can certainly attest to the power of sport in the skill sets that you learn, in the friendships that you make, and the lessons that it teaches you that can be so helpful for developing as a young adolescent. And so it's wonderful that you found that kind of niche to support immigrated children and make sure that they were able to really integrate into their communities and learn these skills and find these friendships and all of that. So congratulations. And I am sorry to hear that it couldn't continue past COVID, but perhaps others will pick up that baton and continue, or perhaps you'll be able to return to it at some point down the road. So let's wrap up our conversation, Estello, with one of the hottest topics of today, which is artificial intelligence. What's your take on how AI is being integrated into medicine, or how it can be integrated into medicine? And do you think it'll be playing a bigger role in diagnostics and treatment in medicine in the near future?
AI in medicine is the second most exciting advancement that's coming out, second only to the gut microbiome. And I think that the potential usage of it, I've seen a lot of really cool stuff out there. Some of the stuff that I'm most excited for is a lot of the scribing technology that I've been seeing recently. And so I think that there should be a distinction between AI taking the place and, fulfilling the role of what physicians are doing today, and AI supplementing and augmenting the ability of one physician to help more people, or to help people more accurately. So I think that the best use of AI right now is going to be kind of like working with our doctors and physicians in a way to augment things. And so whether that's a technology that allows you to streamline your note writing timeline, and to make it easier for you to write your notes, because the amount of paperwork that you have to do in medicine is nauseating at times. And so anything that's going to help make that a more efficient process is going to be really great. And I've seen some really cool companies coming out with, whether it's software that listens to your conversation with the patient and generates a typed consult based off of that, or it's something that can help pre-populate past medical histories and all these kind of things. I'm really excited about that, because that's just going to make the day-to-day job of being a physician so much easier.
Yeah, I'm glad you mentioned that the administrative burden on healthcare providers is so high. And that's one of the things we've been tracking a lot, is which technologies, like you mentioned, these scribe technologies, perhaps a bridge, if you're familiar with that. I know there are many others, but how can they really cut down on the administrative burden of healthcare professionals and hopefully reduce burnout? And so, I mean, among other benefits, we would love to see healthcare providers be able to spend more time with their patients and more time caring for their patients, instead of doing notes and writing, histories and all of that. So I'm really excited about that, and have heard a lot of hope behind these new technologies as well.
Yes, yeah. And the other area that I'm particularly excited about within gastroenterology is that they're coming out with a lot of AI augmented colonoscopies and imaging software. I've yet to get my hands on the scopes and to see what it's really like, but what I've seen is that they have software that'll, as you're doing an endoscopy, kind of augments your polyp detection, and will highlight areas that it thinks is suspicious, or will kind of help you to identify if something's there. I think that any specialist should learn the skill set that they need in full, without assistive features like AI, etc. But I wonder if a feature like that might make the job of a gastroenterologist a little bit easier, or maybe would make your, adenoma detection rate a little bit higher in the future. I'm not sure what the data, the research on that says, and I'd be interested to look into that and see if AI assisted adenoma detection rates are higher or not. But that's one area that I think is pretty interesting, pretty cool application of artificial intelligence technology in medicine as well.
Yeah, definitely. We know that AI is quite good actually at that pattern recognition and building algorithms to help predict those patterns. And so I would love to see that again, either cross-check what existing providers are already doing or use that as more preventative care for those who either may not have access or for those who may not have as much time, with their providers and things like that. So definitely an exciting topic. We're also within Osmosis and Elsevier very excited about the clinician support tools that we can offer. In fact, we just recently launched something called Clinical Key AI within Elsevier. And it's essentially a point of care tool that is an AI chatbot for a doctor or nurse practitioner or PA to interact with and just have that immediate real-time feedback on comorbidities or, which medications may be interacting or get references in real time. So we're really excited about those types of tools as well. And certainly following this field with wide eyes and excitement to hopefully continue improving medicine and advancing it for the patient outcomes to continue improving.
That sounds fantastic.
Yeah. And so, Estello, you were obviously a recent medical student and you've been in the shoes of healthcare professional students. And that's largely what our audience is made of. And so I'd love to ask, what's your advice to these early career health professional students about meeting the challenges in healthcare today?
I think the best advice that's been given to me and something that I've really, really stuck with is to take things one day at a time and to not compromise on what you truly want and who you truly see yourself as. I can't count the amount of times I've been anxious or discouraged by looking at what I wanted to do and how long it was going to take to get there. And I can I can clearly remember what it was like in undergrad when I made that decision to want to pursue medicine, to look at it and be like, dang, like that's all of undergrad, all of med school, all of residency, then a fellowship, and it just felt like it was this incomprehensible feat to surpass, this unclimbable mountain. But the same way that you start an ultramarathon, which is like 1 foot at a time, and you just go one after the other and you keep going, medicine is literally the exact same. And you're capable of it as long as you keep your feet moving. You're capable of it as long as you just keep going in the direction that kind of is truly what your calling is. And so now that I'm here on the eve of starting my gastroenterology fellowship in 1 week, it's surreal to look back and to realize that, you're kind of almost at the top of that mountain you're at the foot of. You've come this far, and it truly is just one day at a time, 1 foot at a time, and before you know it, you're where you want it to be. So yeah, that's what I would leave them with.
You're certainly an inspiration, Estello, and the epitome, perhaps, of compound interest in the form of effort and discipline, and just how that, daily discipline and doing the work each day can take you this far. And you've had just such an impact on the people around you. I know you've had an impact at Osmosis and both the fellowship program and within our education team and our content creation team. And so we're certainly excited to see you continue your journey in medicine and to follow that journey, and wish you the very best of luck as you start that fellowship.
Thank you so much, Hillary. It was a pleasure to be on the show this morning.
Well, thanks so much for being with us today, Estello. And with that, I'm Hillary Acer. Thanks for checking out today's show. Remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisetheline podcast.